and the new road system and the new park planning that's currently underway. That is to the immediately to the west. St. Paul's Hospital, currently that is subject to a rezoning application. It's for the development of a world-class health campus and research campus immediately to the south of Pryor Street, next to Pacific Central Station, on the vacant land that is situated there. False Creek Flats plan, there's a lot of proposals through the False Creek Flats for better connectivity across the rail going north-south, and also for new development happening particularly along Main Street associated with the new digital technology, knowledge industry, innovation and creative clusters. With the St. Paul's Hospital, it's potentially being built in the next 10 years on the site next to the Pacific Central Station. You're looking at a significant connection between the various emergency response activities, the fire halls, the National Works Yard, the Hussar and the Evans Yard, all being very, very critical uses for the future sustainability and resilience of our city. Linking an east-west arterial to this area would make it so much easier for these emergency response agencies to be able to work with the hospital, with the various services running east-west onto Clark, onto Main, and of course into the downtown in the event of any national or local emergency. The Downtown East Side plan is online. It's available for you to have a look at. The predominant point about the plan is to manage change, to wherever possible work towards the growth of a mixed income population with focus on the vulnerable and the low income residents of the area, but also to ensure that the heritage of the neighborhoods such as Strathcona are as far as possible protected for future generations. Grandview Woodlands Community Plan recently completed, associated with 7 sub-areas, Commercial Drive and the various neighborhoods and industrial areas around them. The future in the community within the next 10 to 15 years, Northeast False Creek could become a reality, and St. Paul's Hospital, as I've mentioned, is expected to be constructed within that time frame. You're talking a substantial change in the area of close proximity to our neighborhood. False Creek Flats, a limited amount of residential, but shown with the red and green areas, really around the periphery of the flats, because the flats is one of the last remaining industrial areas for employment, and as I mentioned, very important to the artists, very important to the produce row and the rail activities. If you look at the future in Grandview Woodlands, you're talking about 9,500 more people over the next 20 years, 30 years. Downtown East Side, you're looking at least another 12,500 people. You're talking about the growth in the population in the Northeast False Creek, with the development of probably 10,000 or more residential units in the Northeast Falls Creek area. So we are seeing the future as being city building and substantial change in the new residential development. Also supported by, we estimate, about 20,000 new jobs in the False Creek Flats. Thank you very much, ladies and gentlemen. I thought I should rush through it because I know you've got a lot of other things to do in your agenda today.